Welcome back to another episode of Sports Medicine on Tap. My name is Brandon O'Line. I'm sitting at quite the busy neck of the woods brewing company in Pittman, New Jersey, with my good friend Dr. Frey. Dr. Frey, how you doing?
I'm spectacular, man. How are you?
Good. Tonight we're hitting a very long-awaited topic, if you will.
Yeah.
And we brought a new guest on tonight.
Yeah.
So, Dr. Frey, if you don't mind, would you like to introduce our new guest?
Yeah. So new doc within our group. Very excited to have him on board. Dr. Marc Harwood. He's kind of a Philly guy through and through. Undergrad at Temple, med school at Temple, residency Thomas Jefferson, fellowship, sports medicine Thomas Jefferson, and then going right on up the chain, stayed around, stuck around the area. He has a pretty impressive background here, man. He's a team physician for Philadelphia Ballet X, former team physician for Cirque du Soleil, former team physician for like some WWE type stuff. And then 16 years as a team physician for Philadelphia Phillies, former president of Major League Baseball Team Physicians Association. He served as in the past fellowship director, the director of clerkship for medical students within Thomas Jefferson and different programs previously, and currently the umpire health medical director for Major League Baseball. Dr. Marc Harwood. Welcome to the group and welcome to the show, man.
It's a pleasure to be here. Thank you so much.
So and the timing is spectacular. I don't know how or I don't know why. We've done a few concussion shows in the past, and it's kind of from different perspectives. Right, we did it from the perspective of the athlete, the person who had the concussion, and we've done. We did a show in the past with Jess Harrison, one of our physical therapists, who had done some of the vestibular therapy and the treatment and all that other stuff. But now we got ourselves, let's talk about it from the other side of the issue.
Right.
And we got a kind of high-profile athlete to talk about, right? Right. Tua. Oh, my gosh.
Yeah.
And there's a little disclaimer that we get into all the time, right? We don't actually have any access to his medical chart or his medical information. This is just sort of a leaping point or a springboard into those types of injuries to talk about concussions in general. You're more tied into baseball, right? So we're going to get a little bit of that perspective and some of that stuff. But
correct.
Pretty excited to talk about some of the stuff.
Yeah, it's going to be great.
Yeah, man.
Yeah, so perfect time to talk about baseball, too. It's Phillies are in the playoffs. The Red October's coming in hot.
Congratulations. I know.
Hey, your Steelers are doing really good right now, though.
They are.
They are looking pretty good.
Yeah, 3-0. Very excited about that. And my Mets, they're in the hunt, man.
There's still a chance.
Yeah.
It's not over till it's over.
Yeah, for sure.
So tonight, like we mentioned, we're going to talk about some concussion stuff. And who better than to talk about Tua Tagovailoa, who's been in the headlines for concussion for a few years now. And just to go over a little bit, just recently, it's the 24th right now. We're recording like we always say on a Tuesday.
Yeah.
He got injured about 12 days ago against the Bills.
Scary.
And the crazy part was he was, it was a fourth down situation or something like that, and he decided to run for it, and he went head first.
I knew it was coming.
And initiated contact with none other than Damar Hamlin, which is just another amazing story.
Right.
The ironic part of it, and then goes down, which seems to be loss of consciousness. He does the posture again,
the hands
and
go
then
up.
the hands go up, and everyone's just like, oh no, not again, right? Because luckily, last year he played his first ever full season. He was completely healthy. He did really well, led the league in passing, the whole everything. Did really, had two of the best wide receiver duos in the NFL.
Yeah.
But then the year prior, just to give some more background, the first documented concussion in the NFL was back almost exactly 2 years ago to today, the September 25th of 2022, ironically against the Bills. He got tackled. I think he got pushed and kind of fell backwards, hit his head, and then he got up and he kind of stumbled off.
You see him
fumbled.
fumbled.
You saw him go down.
Yeah,
and
I
I think,
that.
and there was some controversy, I think, about this whole situation because, I think it was reported on that topic that it was his back. He had like a back issue, and that's kind of why he fell over and all this like kind of murky stuff in the waters. But from our standpoint, we saw him hit his head pretty hard.
Yeah.
He got stumbled up, and then they had a Thursday night game following that.
Yeah.
And so just a short 5 days after,
quick turnaround
on the 29th against the Bengals, he went down, and he also had the iconic picture that his fingers were all in different shapes and whatnot, and then he was out for about 4 weeks, and it was like a big, it really blew up from there. And then he got back in 4 weeks, played the rest of the season injury-free, and then apparently he's been spending all this time in the offseason practicing Brazilian Jiu-Jitsu, learning how to fall better, knowing that he should slide and not initiate contact. But here we are 2 years later, and he did exactly what he trained not to do, and he ran right into someone head first. And here we are talking about his head again.
I mean, I'd like to say competitors are competitors, and it's one of the reasons why he's at that level.
Correct.
I think it's very hard sometimes for these guys to not, like if they feel like it's a very big play, they need that first down. Like there's a lot riding on it. They feel, and they're through their careers they've been the best, right?
Yeah.
They're pretty invincible, but every now and again, it comes back to haunt them.
Yeah, no, it's what makes great players great.
Right.
When you're trying to clear someone for competitive sports, I try not to ever say to someone, well, you can go out, but go out at 70% yourself.
Yeah.
It's like, well, what does that mean? So you're either going out 100% or you're not going at all.
That's right.
Yeah, and it gets interesting, right? Like it's just one of those things. So right now, as of now, per the most recent reports, he went on the IR in the NFL, so he's out a minimum of 4 weeks. And, he's apparently meeting with different neurologists. He's been reported to say that he doesn't plan on retiring. So we can speculate on if he comes back, what's going to happen.
And that was a big conversation. As soon as everybody saw it happen, like, oh, is his career over?
Yeah.
Of course, my mind too. And I remember that way back when, like this was before concussions were really the topic that they are now, right?
Yeah.
Like really, it became a big topic, in Pittsburgh, right? Like where
Mickey Collins and
Yeah.
the whole crew. Yeah.
Exactly. And it was uncovered, and like that just how impactful and significant they are. But even way back when, I remember Steve Young going through this before all of that, and a number of other athletes going through this. So a little bit scary when you see it happening over and over to the same guy.
Yeah, and you don't want to see that. And then, I think on, as far as diagnosed concussion, this would be his fourth. I believe it was reported that he did have one at Alabama, and now he's had 3 in the NFL, and I think they've all been pretty significant. At least the last 3 have been pretty, prominent, and, it's just when you're in the national spotlight and millions of people are watching, it makes a big push media-wise and everything else, and then it leads us to this discussion we're having tonight.
Right. So, in that vein, just generally speaking, because I think there's a lot of lack of understanding or misunderstanding or sort of old school understanding of what a concussion is. But would you mind going through a little bit for us, like what is going on there? What is a concussion?
Sure. A concussion is quite frankly, a brain injury. And it's really a physiologic response to a brain injury. It's a characteristic cluster of symptoms that cross multiple domains. Headache is included in that, mood lability, vestibular dysfunction, sleep dysfunction, and it's basically a characteristic group of symptoms that result in, or that arise from typically a shearing type of injury in the brain.
Like in this instance, he has this injury.
He's
evaluated, and in the NFL, they have independent neurological consultants on the sideline who get seen. Now we're at this point where what happens now? He's meeting with these neurologists. They're trying to clear him. But I don't know. What are your guys' thoughts on his career outlook if he comes back in this 4-week minimum kind of stuff?
In terms of, I think that he can come back and play, and they'll clear him. They'll go through all the right steps. I'm gonna cage everything with the understanding that it's a little bit outside of the realm of what I particularly do.
Correct.
Right? Yeah. So just take it with a grain of salt. But typically, I think that he can come back. I think he'll play again. I don't think that his career is necessarily over, but I think it is worrisome, right? And people who get a concussion, you worry because it becomes easier to get the next concussion. How much downtime do you need? How many issues does he have? I guess it remains to be seen. We don't have access to his actual medical chart, but there's a lot of testing that they will do, his eye tracking and whatnot, before he's actually clear. The idea is not just like, all right, the headache's gone, get back in there, kind of a thing. There's a lot of things and a lot of steps that he has to, hurdles that he needs to clear in order to get back. But you do worry, man, like multiple ones have happened. Is this going to keep happening? And then how many is too many? And it's going to, I don't want to start going down this road because I have a feeling this is going to be its own separate podcast in a not so distant future. But you worry about things like CTE, chronic traumatic encephalopathy, but which related to concussions, but not always, right? There are other issues for that. But what are your thoughts in terms of?
No, I think that this is a very, very difficult issue, and I think that this is part of the reason why I'm glad I'm not on a medical staff of a professional team any longer.
These are tough calls to make.
These are very difficult calls to make, and it's interesting. I think that my orthopedic colleagues do not, by any stretch of the imagination, misconstrue this as saying that your job is easier on the professional athletics, but your job is more clear cut.
Yeah.
Right.
Concrete. Yeah. Defined.
Can you play? Can you perform? If you can't, and there's an issue that can be fixed, you fix it.
Right.
Yeah.
Right. Concussion is one of those issues that what we're really talking about is the future of this guy.
Right.
Right. He in 4 weeks, he's not going to have a hard time performing on the field. Right. From a cognitive standpoint, he's not going to have a hard time remembering plays. No one is going to outwardly know that there's an issue.
Yeah.
But the question is this a bullet that has been fired and is not going to hit the target for another 30 years?
Yeah.
What is our responsibility to the player? What is our responsibility to management? What is our responsibility to his agent? What is our responsibility to administration and ownership?
Yeah.
And all of those different groups have a very different vested interest and very, very different interests.
Right.
And there are huge conflicts of interest here. From if you are an employed physician that is responsible and reports to management, that often conflicts with what is really best for this individual. So the NFL went so far as in 2016 they commissioned the Harvard Law School to look at health and safety of NFL players, and came out in their publication is readily available. We can include it in the show notes if you'd like. Their conclusion was that team physicians should not report to management.
Right.
Period.
Yeah.
There should be a club physician that reports to management, and there should be a player physician that does not report to management. And so the team physician that is there now has really got a tough situation. He's got to keep Tua happy, and he's got to keep ownership happy. He's got to keep the agent happy.
Right.
That's not easy to do.
No, of course, and it's a balancing act. And, we've kind of touched on that exact topic before, right? And I feel like, and I like to think, and I hope, and we were working with the Philadelphia Soul and the Philadelphia Blackjacks, the Arena League football team for a while, and we would always try to figure out where do we lie, and really it's hard, but really you do your best. Like, we're docs, we're here to take care of people, and you try like that's the priority, right? And you try to make things work, and you try to be the peacekeeper between different party interests, but the bottom line is I think all is lost if you don't have the trust of your athlete. And the only way you have your trust of the athlete is by having the athlete's best interest in mind. I think what really makes these concussions especially challenging to treat is a statement that you made earlier, which is like, it's you're firing a shot that might not hit the target for another 30 years.
Right.
And do we know like we have some understanding, but we don't really know it well enough. We don't know if that shot's going to hit the target, miss the target. Is it going to be a problem? Is it not going to be a problem? So it's a little bit of like guessing and just working with what we have.
We have no idea.
Right.
Yeah. This could be an isolated group of events over the course of the last 2 years, 3 years, and never be a problem again.
Right.
And the next concussion could be the one that kicks him over the threshold. We'll never know. We'll never know.
And I think with that said, it's just like, just if you look at, again, I'm sure there's some numbers, but look at everybody who's played in the NFL ever. And you have those guys who've made the headlines because of CTE and all the issues, and unfortunately taken their own lives, but they've saved their brains for all this research and all this stuff's happening.
That's crazy.
But then you look at the guys who may have been teammates with those people and who are completely fine.
That's right.
Same age, same everything, or even older, or whatever the case is, and they're just fine.
Tons of people playing all these sports, right? So football, hockey, rugby, soccer to a lesser, lacrosse, they're the higher impact, higher concussion type sports. there are plenty of people who play these sports and never have any of these issues whatsoever.
Nope. No.
And so like it's not like you're doomed if you play the sport and you're selling your, but at the same time there are a few people who do have these problems. It makes it tricky.
There's just inherent risk with these sports, and then people just take them, and all this stuff happened, especially with the big, I think after the Will Smith movie Concussion came out, it blew up, but still
after the book,
people are signing their kids up to play football. Kids are still playing football in high school, college, and it's not stopping anytime soon.
No.
And I think, like we mentioned before, is just I think the external pressures of these situations dealing with these athletes.
Yeah.
When you're dealing with someone like Tua, who just signed a $200 million contract.
Right.
This guy's like a $170 million person that this organization is investing in, and you're in charge of what he's doing in his long-term health.
Yeah.
That's a tough spot to be in.
It is. It really is. And if you look at the data surrounding youth football, incredibly safe.
Right.
Yeah.
Right. F equals MA. Right. So little people who aren't moving that fast don't generate a whole lot of force.
Right. The mass is low.
Yeah.
Acceleration is low.
It's not until you get to the higher levels where these guys are enormous and moving at a rate that they shouldn't be moving at that the forces get so high.
Right.
And so you parents potentially are getting lulled into this false sense of security. Nothing ever happens on my youth football, my Pop Warner football field. But it sure does when you get to the high school level.
Yeah. Oh, for sure. And I mean, I played high school football. It happened, I went through it. But then again, that was, 15-ish years ago.
Yeah.
Concussions were treated completely different then.
Right.
Yeah.
And we talked a little bit pre-show just how, I don't know, 15.
Got his bell rung.
Got his bell rung, and symptoms went away in 5-10 minutes. Okay, go back out there. Like just the crazy, the cascade of events that happen over the time and just change everything.
Right.
It's a much different outlook now, and I think for the better, but still, like we mentioned, I think we're still in the tip of the iceberg.
Right.
There's just so much more to it, and so many different avenues to go down. Like we mentioned, the vestibular stuff and all these other different avenues of treating it.
Yeah.
Because even still, treating it's been different as well. Just keep them in a dark room for a couple of days and let the symptoms die down. Now it's like sometimes you promote light aerobic activities, the increasing the heart rate to see if it increases. Sometimes it helps a little bit different.
Yeah.
So again, I think it's just so much to it that.
So I think you hit the nail on the head on one of the things. I'm kind of curious to have you elaborate a little bit for us. The idea of got his bell rung, you're feeling a little bit better, the headaches, get back in. That what are some of the concerns potentially with someone who maybe just had a concussion or in that sort of post-concussive period still concussed and being back out and being at risk and being exposed and possibly having another hit or another concussion?
Yeah, I mean, what I was taught as a fellow was that if you went back out into the field of play, got a second concussion while the first concussion was in the process of healing, that there was a potential for what we called second impact syndrome, where there was auto-regulation that was disrupted, rapid cerebral swelling, and instant death. And what we've really learned is that that may or may not be a real condition.
Fair.
And so we used to tell people on the sidelines, because I would hear, well, he just got his bell rung. Why can't my son go back in? I was like, well, my stock response was, well, they could get second impact syndrome and die, and we're not going to take that responsibility.
Right.
And that usually shut things down.
Yeah, that takes a lot of pressure off.
It takes a lot of pressure off. These days, I don't say that because there's a lot of stuff in the literature now about whether or not second impact syndrome is real. There are a lot of people that are not fully on board with that, and the parents, generally speaking, have aged out of that type of thinking.
The old school mentality.
Yeah, the old school mentality. But now the parents are coming to us and say, "Hey, my kid just got hit. Why aren't you taking a look at it?
Should you pull them out?
Yeah,
which is wonderful. Right?
I've got my independent neurology consultants in the stands. So it's kind of nice that way.
Yeah, and I think it just comes with the times of just like you said, using second impact syndrome as just like reasoning, and it usually it shut down a lot of conversations, a lot of heat, just kind of calms everything down. But and I think expanding the general knowledge of it has helped. But then it's also put an extra eye on everything too. It's just more scrutiny and everything.
Right.
And Tua was kind of the start of it. Miami's medical staff was on the hot seat that week back in
That was
2022.
that was an ugly,
That's that's a tough look for that stat, and I couldn't imagine being in like we mentioned that pressure situation of like, oh man, now the whole world's looking at us.
Right.
Yeah.
Well, and then I think it was before that, right? Do you in New England? Not was it Edelman? Well, I
Probably
forget
Edelman.
which one of the receivers it was.
Or
the
Wes
Super Bowl.
Welker.
Was Wes Welker?
Yeah.
Right. Who you see him get his bell wrong, you see him stumbling all over the place, and then you see him back in like 8 plays later and winning the Super Bowl. Right? So, which is not the way this is supposed to go, but like I guess they took their risk.
And to go with that, and speaking of Julian Edelman, at least you mentioned him. I don't know, not too long ago I seen him on some podcast of some sort, and he talked about like the things that we don't want to ever hear of like.
Right.
When they would get hit on the field, they help each other up. Hey, this is today's date. This is what's going on. This is the score of the game.
Really?
Yeah, he was on a podcast, I think, with Gronk or somebody, and they were talking about just some old player stuff. And I was like, that's a little tough. Where it's like the nature of the beast, if you will, of football at least. It happens. You see it all the time, and then it's kind of sucks from our standpoint. It's like when we get lied to straight faced, and we can't like prove it.
It's
sometimes.
hard. It's hard to. I guess there are some things that like you can't fake, right? Like eye tracking, but it is. It's
It's hard.
You know this better than I do, right?
No, it's hard. I guess the question that I would have for you is, would you let your kid play football? Right?
No shot.
So it's funny that we say this because I was talking how of course, right? Every orthopedic surgeon does a great job, other than when it's their own family. Right. And we were just joking around how my son broke his finger. He's a soccer goalie, and I let him play with it for the last 10 days, 12 days before finally he got right. So going back whatever it is, 5 years, 10 years, my wife was like, no football, and I was like, I'd rather not, but if he really wants to, I'd be okay with it. So the irony here is that. Now he plays soccer, which is also a higher concussion, and he's a goalie, which is one of the positions where people have a lot of collisions, right? He's a goalie in lacrosse, and he's a wrestler, which is another sport in which people get concussions. Like, did we help him by protecting him from football? Just because football it's a stigma, right?
Right.
And don't get me wrong, I think football and probably rugby are at the top of that list. Really football at the top of the list. But those other sports aren't dramatically different. You still see concussions. You're still at risk.
I hear you. I struggle with this. My sister, who's probably going to listen to this, her son just started playing football. He just went to high school. He's on the 9th grade team. Yeah. And she asked me, is it okay if Milo plays football? I'm like, I don't know. I mean,
I don't know.
From my perspective, like there are very few team sports that are better team sports than football.
Right.
Like if you don't do your job, people are going to get hurt. Yeah. And it's trauma bonding, if you will, right? Right?
That's a good way to put it.
Right? Football teams are tight, and there's a reason that they're tight.
Yeah.
And it teaches you to do your job well, and just be, no matter how little your job is, that's if your job is to block and you don't do that, someone's gonna get hurt. Yeah. And so it teaches you some really tremendous things. That being said, it's inherently dangerous. It really is inherently dangerous. So I struggle with it. I really do.
Yeah, I agree. It's just one of those things where there's a risk to it, but heck, I was a kid. I wanted to play football. I had the dream of being on the high school football team, doing all this stuff, and then orthopedic injuries and other things steered me the other way. And I still played 3 years of football in high school, and I went through it, hit my head a bunch, and here we are.
Yeah,
doing okay.
We're doing all right. You're not the only one.
Right. Exactly.
Yeah. Taking it in another direction now. Someone was playing football Friday night, Saturday, whatever it is, and they got pulled out of the game because they had concern for concussion. Now they're seeing you in the office, and you do 1,000 other things. This is not the only thing that you do, right? What are some of the steps, or what are the things that you're doing, working through, that you're looking for in terms of determining, was it truly a concussion, and how well is that person doing, and working towards getting back to being able to play again?
Yeah, I think that the first thing that I try to do is talk to the athletic trainer or talk to anybody who is actually in there.
Yeah.
A lot of times these kids come in and they just want to play on Friday.
Sure.
Right, so they come in on Monday morning. I'll tell the doctor whatever he needs to hear in order
my
to
son included.
Yeah, in order to play on Friday. So it was nothing.
Right.
I had symptoms for 5 minutes. I'm ready to go. And then you talk to the parents who are like, no. you slept all day yesterday, Sunday. You missed the Eagles game, which you never do. And so trying to get a sense of what symptoms brought them for an evaluation initially, and then trying to also get in touch with the athletic trainer. The athletic trainer was there. They were the one who evaluated them. They're the ones who probably prompted the evaluation with me in the first place. Right. Talking to the boots on the ground and talking to the people who evaluated. So that's step number one. Step number two, well, what has happened since then? Did you have, you may have had symptoms, may have had observed symptoms, headache, confusion, dizziness, gait instability, stumbles, those kinds of things. But over the weekend, you actually did okay. Parents are there and they're saying, yeah, it seems fine. So getting an inventory, if you will, of what their symptoms are, and trying to put those symptoms into buckets. We were talking about the domains of concussion. Is this mostly a dizziness concussion? Is this mostly a fogginess concussion? Is it mostly a vestibular? Is it mostly headache? Is it mostly mood lability? Because people, in my experience, tend to have the same types of concussions over and over again. Right. So if you don't have 5 concussions that are vestibular symptom predominant, and then all of a sudden have like an episode where you're depressed. It tends to be the symptoms are surprisingly within the same domain over and over again. So trying to put them into which bucket they belong in. And then trying to provoke symptoms in the office. So doing some vestibular testing with them, eye movement tracking, saccades, and vestibular ocular responses, those kinds of things in the office to try to reproduce their symptoms. And then seeing where they go from there. I mean, it's really about kind of taking someone who is symptomatic in a number of domains and getting them to the point where they can tolerate full activity without having those symptoms.
Right. Yeah, and I think that's, there's just so much to that, right? Like finding out those things and having that individual pattern, if you will, of what their symptoms are like, and then, how many concussions do they end up having, and just the complexity of the whole situation is just, it's nuts. But like you said, it's just being in those situations where you witness it happen, you see the immediate effects of it. It's like, okay, well, there's something going on here. But then I've had it plenty of times where you see some good hits, and it's just like, I don't know how you don't have a concussion.
That's exactly right.
And that's what it gets really confusing at least, or like troublesome or hard to do your job sometimes. It's just like, man, I got nothing to stand on other than I saw you take a hit. Right. And you looked a little off, but then you get to the sideline. We're talking for 15, 20 minutes, and I can't reproduce anything. You're claiming there's nothing wrong with you, and then he puts you in a tough spot. It's like, well, you don't want to have him go back out there and see something else and have a Tua effect of where you see him 4 days later and he has even more symptoms or all that other stuff happening. It's not something you want to be a part of.
And then there's the opposite story where you have someone who clearly has concussion symptoms, and no one on the field can recall them being hit.
Right. Yeah.
Right? The worst concussion that I ever saw was the team position at Cheney at the beginning of my career. And we looked at tape. We could not figure it out. And this was a kid who came into the training room. We used to have games on Saturday. We would do a training room on Sunday morning. He came in on Sunday morning, and he didn't know his telephone number. He didn't know his address.
Right.
He didn't know.
Scary stuff.
Yes, he didn't know his hometown. And everybody else in the training room, all the players were like laughing at him. And I had to shut it down. I'm like, this is not funny. Like, this is, he's really sick right now. Yeah. We watched tons of tape, and we think that he was a running back running up the middle, and he got twisted around very rapidly. So we think that his head got whipped around, and that's what caused it. Yeah. But like, no one on either sideline saw a hit. In retrospect, we were looking at the tape, we couldn't find one. So it happens both ways.
Yeah, so before we go ahead, I just want to give a quick shout out to one of our sponsors, Virtua Orthopedics and Spine. They have you covered from runner's knee to dog walker's hip to yard work back and laptop wrist. They have a doc for that. So find the right specialist for you at virtua.org/ortho. So yeah, just to kind of go back, like you said, the spectrum of it. You have somebody who barely gets hit and they have symptoms all over the place, and someone who gets completely demolished, you would think, and they're like completely fine.
Yep.
And we have those athletes, and just that threshold is so different. And I think that's where, to kind of tap into some other stuff that we're talking about of like, just looking at this weekend in the NFL, right? A couple notable names, and, we do kind of favor some Philly sports a little bit. We have Lane Johnson and Devontae Smith from the Philadelphia Eagles both got knocked out of the game for a concussion. Lane Johnson, I didn't really find a tape of it. I just saw him kind of walking off the field. He looked kind of concerned, and I think there was a report that he kind of was throwing up on the sideline or something along those lines. Then Devontae Smith took a wicked hit, and it was just one of those plays in football where it's like, it's tough to, again, you can argue, well, he was going kind of backwards. The play should have been stopped dead, but then this guy's still coming full steam, and he just takes his shoulder right to the head, pops his helmet off. Looks like he kind of loses consciousness for a second. He kind of goes down, not moving really well. And it's just like all these different things where Lane Johnson, it's not reported. It's not like a video like, oh, this is the hit that did Lane in.
Right.
Like,
Yeah.
And then I think the other name I put on my sheet here, last night in Monday Night Football, Austin Eckler got taken out of the game with a concussion as well. Again, I looked it up, and there wasn't really a hit. It was just, again, it could have been a cumulative thing. Could take a couple in the first couple plays or whatnot, and then over time it just got worse. And that's the interesting part of it, right? Like, you could take a hit, and the symptoms don't happen right away, and then an hour later, then all of a sudden all these things start happening, or the next day or whatever.
What are some of the things, right? Like the NFL has taken this seriously, right? Like they've invested a lot of finances, a lot of capital into trying, because like this is like theoretically became one of the things that like this could be the NFL's undoing. Right? Like this is a really big deal, right? So they've invested an awful lot, resources, time, and man hours and capital in terms of trying to make it safer, right? And then proper tackling form and whatnot. What are your thoughts? There's a few different things out there. Some of the different helmets, something called a Q collar that's out there, guardian cap. What are these different things, and what are your thoughts on whether these things are helpful and whatnot?
It's a good question. I think the jury is still out.
Yeah.
I really think the jury is still out. I think that any type of head protection is really designed to help reduce skull injuries, skull fractures, those kinds of things. Think of it kind of like
which was a really good point. It has to be on your radar. Like if you're the sideline doc or the athletic trainer, like, yeah, if it's a concussion, I know what we're doing, but I got to make sure it's not that, right? Like
that's exactly right. That's exactly right. Like, that puts it, there's concussion, which is little m, minor traumatic brain injury, and then there's TBI, right? Traumatic brain injury, right? So, car accidents, high velocity, those kinds of things. The argument could be made that with the posturing and all that stuff that Tua's stuff is more traumatic brain injury than mild traumatic brain injury.
Correct.
However, I don't have access to his records or any of that stuff.
Sure.
But so I think that all of the guardian cap, the helmets, anything that you're going to apply to your head is kind of like my daughter's project to protect an egg. Right? She had a science project where her job was to build something out of toothpicks that can help prevent the eggshell from breaking when it's dropped from a certain distance.
How high can you go?
How high can you go? Yeah. It's not designed to take the egg and prevent what happens to the yolk when you go like this.
Yeah.
Right, when you shake it a bunch, right.
Right, and there's nothing that really can be done.
Analogy.
Yeah, it's not mine. I wish I could steal it, but it's not mine. I was going to give credit where credit is due, but I don't remember where I heard it. Adding an additional layer of over the helmet with the guardian cap seems like it's more adding additional toothpicks to the egg project.
Yeah.
If you look at the data that's published, maybe there's somewhere between a 10 and a 25% reduction in head acceleration forces, which when they studied it in the college world, in the NCAA, they didn't notice that there was any reduction in concussions. The NFL has some proprietary data, evidently, that's not published, that they looked at concussion rates with and without the guardian cap during practices. And evidently, it cut down the concussion rates by about 50%. I would need to see...
That's a huge number.
I know.
Right.
I would need to see that data because, number one, are you reducing the number of concussions in practice from 2 to 1?
Right.
Right. I mean, it doesn't. It's a problem that doesn't seem to happen very often.
Well said.
I rarely, when back in the day when I did fantasy football, I don't ever recall having to put someone on the IR because they got a concussion during the week in practice.
Right.
Good point.
So I would have to see that data. The other thing is it's certainly not random. It's certainly not blinded. Right. So everybody knows that someone's wearing one of the Guardian caps.
Right.
The player knows that they're wearing a Guardian cap, so maybe they're less apt to report something. Who knows? But I would need to see.
There is a little bit intrinsic bias. There's no way
Yeah.
to avoid that.
Yeah. So I think that the Guardian cap remains to be seen. Do I think it does further damage? The answer to that is nuanced.
Right.
I don't. It clearly doesn't do further damage. Does it help? Maybe.
Yeah.
But it is a little. It's a little more nuanced than that because if you've ever been to a little league baseball game recently, everybody's got the elbow thing.
Yeah.
Everybody's got the mouth guard.
Sure.
Everybody's got the ankle thing. So what happens at the big leagues tends to trickle down to the lower levels. And if the big league guys are wearing Guardian caps that are unfounded, it may put additional pressure on lower levels to spend money where money probably should not be spent.
Yeah.
Right. So I think that do I think it does further damage to the individual that's wearing them? No. But is there a trickle down effect in youth sports? It could be.
Right.
It could be.
Yeah, and I think with that being said too is that the trickle down effect is coming in that the NFL is now allowing players to wear them in games,
Right.
and they're making the custom, the covers for them, so it looks like a helmet, just looks a little beefier, a little bigger ahead.
Yeah.
But it's trickling down, and I think we're going to see that sooner than later in college football.
Yeah.
As mentioned before, I do work at Rowan University. We use Guardian caps for our football team.
Right.
Again,
Does every position, or it's not all? It's just eligible position?
It's everybody but quarterbacks.
Everybody quarterbacks. Yeah.
Because they're generally a protected position in the world of football practice. You don't really touch a quarterback at practice ever.
Right.
Outside of a very odd, random trip, a quarterback's really not falling to practice. They're relatively a protected position. Everyone knows not to touch a quarterback. So usually in a different jersey color.
Right.
They're not with the offensive defense. The jersey colors are completely different. So they're generally protected. Other than that, everybody else has them on. Yeah. As an introductory thing, you start it off as like if you have a budget issue, you start with just the people who do it the most, and you start with the people in the trenches, and you kind of work your way out. Yeah. You do like everybody inside the box, if you will. The running backs, the linebackers, and the linemen who are subjected to the subconcussive blows over time, which is another topic of discussion.
Yeah, that's another big one.
The small impacts over time, how that add up. But also with that too, with the Guardian caps, same thing with helmets. I think helmets for a long time were like, oh yeah, I got a helmet on, I'm good for protected against concussion. I stop anybody who plays football. Like, listen, this helmet only does one thing, and it does it really, really well. It will prevent your skull from getting fractured.
That's right.
It's so good at it. Yeah. How many times do you hear about skull fractures in football? Not often, unless it's something that's where the helmet's probably not there, right? But it doesn't stop the concussion from happening. Like, the analogy of the egg, or like I've always used the ice cube in a cup of water. You shake the water, it's going to hit the sides eventually, depending on how much you shake it. Yeah. And then with the Guardian cap, same with all protective equipment. If I told any of us to go run into the wall, they'd be like, I don't know, that's a good idea. If I put a bunch of pads on, you're like, I'll give it a shot. So you just add another layer of padding, and you might go the opposite way of like, now we have something else, so maybe I could go a little harder and I'll be a little safer. And then you increase velocity and acceleration in some things, and I don't know, does it make it a little more dangerous because you have this false sense of extra protection when it's just like, maybe we should just calm down a little bit for practice and save the big stuff for when it matters. But
any thoughts or any knowledge or about the different helmets that are offered now to purportedly to try to reduce the risk of concussion and modification?
Again, I think that each of those companies has their own proprietary data that they just don't want to publish. Right. And so it's hard to vet whether or not one simple design tweak is making a big difference. Yeah. There might be something to it. Yeah. Hard to say.
Because I have parents of players and whatnot who will be like, oh no, we can just get the better helmet, the special helmets, and then we don't have to like it's not really work like that. Like just like you're saying, they're great. and hope the greater, preventing the bigger injury or the biggest scare,
Right.
but it doesn't eliminate the concern about a
Right.
concussion. And I don't know that the data is really fully there to say like just how well they work and
Yeah.
whatnot. I think it's been accepted that they're probably better, but I don't know if the data is truly there.
Yeah.
And then that brings me to the next one that we're seeing sort of pop up on the TV screen, with NFL players and different sports wearing a little more frequently Q collar. What is the sort of the logic behind Q collar?
So
do we have data for that one? Do you think?
Yeah, so the idea behind the Q collar, I mean, it's an interesting idea, right?
It is,
you,
right.
you put this collar on, and it basically prevents blood flow from getting back into the central system.
So it keeps a little more up in your noggin.
It keeps it a little more up in your noggin. So it's kind of like a pneumatic splint for your brain, if you will.
Yeah.
So instead of the brain being able to slosh around a lot, it sloshes around less. At least that's the theory.
That's the theory.
That's the theory. I'm not sure that's ever been shown to do that.
Right.
Right. I feel like to measure that.
Yeah, I don't know how would you measure that without an intracranial bolt, right? Without measuring the actual pressure of the CSF. I don't know how you would measure it. The theory seems to make sense. Some of our umpires had used them in the past. Some of them still use them.
Yeah.
I'm not sure there's much to it. Again, it's another thing that I don't think it's doing further damage.
Right.
Right.
And I think actually they have an FDA approval, and it's sort of based on that. Like,
Right.
It's not hurting you.
Right. Exactly.
We don't know if it's helping you.
Yeah.
They
then
can't
it's
make
also
that claim. It's not hurting you.
With that too is like the FDA. I'm pretty sure. Again, this is a raw statement of like they based off that stuff off the studies that they produced themselves and they submitted. It's like of course
Well, there's
you're
bias
gonna,
there.
a little bit of a bias situation, but if the data that they provided suggested in the theory you can get behind it, I mean. It's better than doing nothing, I guess.
Right.
And like even to go with like we're talking about the helmets is that these new we use Rydell helmets at work,
Right.
and I can only speak to them because there's some other like Shutton and then whatever the
Shoot and Zenith or something.
Zenith, I think, is the one that Patrick Mahomes wears.
Right.
He's got some I think ties with them. But the new Rydell helmets that you see have like almost like broken pieces now.
Yeah.
It started, I think, at least from my memory, Peyton Manning had the first like Speed Flex with the big
In the front.
octagon in the
Yeah.
front. And it bends in
A
a
lot of
bit.
people you see that.
You wear that now, and then you see the newer ones, and there's a piece out on the side,
Yeah.
and it's Axiom or something like along those
Right.
lines. Those new helmets, and those are interesting in that we're just making everything a little bit better. We're leveraging the technology more, where you put the ski mask thing on with a bunch of markers on, and they scan it with the phone, and then it measures your head, and then it custom fits this helmet to fit you head.
That's pretty amazing
perfect.
stuff.
And
Right.
that's awesome, and that's great, right? You want a better fitting helmet.
Right.
Obviously, you don't want the thing slashing around, or older versions are you put it on, it fits okay. Okay, let's add some air to the bladders and make it fit real snug.
Yeah.
Whereas this is like a 3D scan, and 3D scanning and all that stuff's really awesome, and it fits a little bit better.
And I also think there's a little bit of floating, so like the shell will move a little relative to the padding, kind of like different things that could dissipate the impact a little, which might make a difference. I don't know.
I think it's just the idea behind it is just changing where the force goes, right? Like if the helmet gives a little bit, that's taking some force versus the whole helmet going in the one way or whatnot. So I think that's helping in general, but also I think the practice of safer practice is also helping in this regard, right? Like, there's no more two-a-days at training camps. We're not doing Oklahoma drills anymore. We're not doing the bull in the ring and all these things that are just heavy head impacts, where you would see these reduction in concussion numbers along with adding all this extra stuff. So this research kind of makes sense for this stuff,
The changes in the rules, changes in the kickoffs, the changes to protect the quarterbacks. As frustrating as it can be at times, changes to protect the wide receiver.
And I think not too long ago I saw something online of like a opening bit or a skit for CBS football from like the 90s, and it's like this whole entire introduction and highlight reel is all illegal stuff in today's game.
Is that right, really?
Yeah, and it's all just guys hitting right in the headbutt, like spearing people, throwing them down by their heads, doing the sumo toss, everything. And it's just like, that's what the sport was celebrated on, but then the game's completely changed now. And it's like, obviously, along with a bunch of other things, but it's completely different, a little bit safer.
Right.
Still a violent sport.
Yeah.
You can't disagree with that at all, but things have certainly changed.
Now, what about some of the umpire stuff that we were talking a little bit about?
So if you ask my umpires what is the the number one issue that they face, and that would be concussion. That would clearly be concussion. It's on their radar. They get hit on a pretty consistent basis.
Yeah.
Every mask shot that we deal with in baseball, we track where the umpire was standing. We track where the catcher was. We track what part of the mask the ball has hit.
Everything on a baseball field gets tracked.
It gets tracked.
It's
amazing.
Crazy. Yeah.
Interestingly, what has happened recently this year is that there have been more umpires and catchers struck with a follow-through of a bat.
Yeah.
And one of our umpires who missed the most amount of time, that was his injury. He was hit by a backswing.
Right. The umpire.
The umpire. Yeah. So I have a feeling there will be some potential rule changes that are coming down the pike as a result of that.
Right.
But it's interesting for all of the mask shots that we deal with, about 7 to 8% consistently over the years have resulted in a concussion. The problem with that statistic is that the number of mask shots is increasing. So even though the percentage of mask shots that result in a concussion has remained constant, if you're getting double the number of mask shots, you're going to end up with double the number of concussions, even though 7 to 8% of them are going to result in a concussion. Yeah. So we're seeing a lot more. I wouldn't say it's not a huge number, but it's a big enough number that it keeps us busy.
Right. So what are the different ways to try to fix that?
Yeah, it's a good question. I mean, one of the things that's going to be mandated next year in the minor leagues is that they're going to be wearing skull caps.
Right.
So the umpires typically wear a mask with a soft cap, and starting next year,
and a Rydell concussion. No.
That's right. Interestingly, right? That's really designed. Ultimately, the reason that we're doing that is to prevent the backswing stuff.
Right.
Because if you get hit with the backswing, you could break you could suffer a skull fracture.
Right. Disaster, right.
So that's a disaster.
It's shocking to me, like, how does that happen? Like, I just don't picture the umpire being that close to, like, yes, catcher, I can see that, and that's actually becoming a little bit of an issue that catchers is having to catch more often. But, like, how? Umpires, how?
Yeah, catchers are lower and closer to the batter than they've ever been.
Which is why they are at risk also, but I guess that pulls the umpire up.
It pulls the umpire closer.
Right, naturally, because, you see it plenty of times. The umpires are right on the catcher's back. They're leaning over him a little bit, and they're right there. Yep. They're kind of like, their heads are almost like parallel. In the
Go to the other side, man.
Yeah, move over a little bit.
Right? Yeah, no, the umpires are they're under a lot of pressure these days, right?
Oh, yeah.
So number one, everybody in the world sees the little box where the strike zone is, except for the guy responsible for making the call.
That is amazing. That's a
crazy,
great point,
right?
Right? And yet they're right almost every single time.
They're right almost every single time.
Yeah.
But some of them will, in order to get an advantage so that they don't get, everything is tracked. So we have scores for how accurate the umpires are, how often they call balls and strikes correctly, and sometimes they'll be in a position that isn't necessarily what we have defined as the safest position for them.
Right.
That being said, I think that what we've defined as the safest position for them has probably changed, because the data that supported that position, which is known as the slot, was based on data that's about 12 years old now. And most of us think that the game has changed significantly enough that we need to redefine the slot. The catchers are setting up lower, the hitters are swinging up on the ball to get higher launch angles, and it's kind of a recipe for a foul ball straight back to the umpire.
And I think with that too, I think just in general, people are throwing harder, right?
Yeah.
Like, the velocity of the balls are coming in are much.
Without question.
Within the last, decade-ish, if not more, you've seen more people touch 100 miles an hour than you've had before. Like, it was rare. Like, oh, that guy's 100 mile an hour. He's a rarity. Now it's just like everybody has at least one guy who could probably hit triple digits, nowadays. So
isn't it amazing?
It's just crazy how the bigger, faster, stronger just makes things a little more dangerous, and this higher velocity, that thing's coming in faster, and it gets tip a shit or ricochet off and gets tipped, and the next thing you know, that speed's going right to your face.
A little bit of bullfrog. But yeah. So then, all right. So what are some theoretical or possible solutions to change that? Like the game has changed a little bit. Where we thought was the best place for them to be or the safest place for them to be wasn't the safest place. We have some technology. What are potential changes to get these guys out of harm's way? And it doesn't happen super frequently, but it happens, right?
Yeah, no, it happens enough that we've thought about it. You know, I don't know ultimately what's going to happen with the role of the home plate umpire calling balls and strikes.
Right.
That's beyond my pay grade.
Sure.
But it wouldn't shock me if there was some augmented technology that was used to help make that job more accurate, but the umpire's still going to need to be behind the plate to evaluate for check swings, to evaluate for plays at the plate, foul balls at the plate, catcher interference. There are a bunch of things that happen behind home plate. They have to be there.
Yeah.
But do they have to be in the position that they are currently in? I don't know. That may change. We'll see.
Yeah, because I think the most scrutinized job of a game is calling balls and strikes, but there's a lot more than what the umpire behind the plate has to do, like you said. And if you change it up a little bit, and like you said, that white box is only what we see on TV.
That's right.
No one on the field sees that. You just, I mean, it's a forever old argument of arguing balls and strikes with an umpire, right? It's just part of baseball.
Yeah.
It is.
And it's I sort of hate to see that go. You like that human element within the game.
Yeah, and I think that's just something with baseball specifically. It just has that old feel, like the old school history of
traditional
it.
Sport.
The traditional sport. You just want to kind of keep some things. God, that's just baseball.
When I was growing up, that was my favorite part of the game. Was the first 2 innings, trying to figure out what the strike zone for that particular game was going to be.
That's right.
Right?
Yeah.
Like what was Joe West going to do tonight? And how tight they were going to call it. And I didn't mind if someone was calling high balls, strikes, as long as they were doing consistently for both sides.
Right. It's consistent.
If it was consistent, I was fine with it. And I enjoyed that part of the game. And now it's a little bit different. The first couple guys up to the plate don't have to take 4 or 5 balls to see where
figure out tonight's strike zone.
And the pitchers don't have to necessarily paint the corners a little bit to see what they're going to call. It's much more by the book.
Yeah, that makes sense.
I wonder how a guy like Maddox, who lived on the corners and made a career on the corners, how would his career be impacted by a dramatic change like that? Did he just know how to work the umps, or was he just that accurate that he could just put it on the line every time, kind of a thing?
Yeah.
You know what I mean?
It's a good question.
Yeah,
I don't know. Yeah, it's a good question.
Yeah, I'm sure someone who likes information and stats would watch all his film and make the fake box and kind of get those numbers out. I'm sure it might exist. Who knows? But
I bet it's out there.
I bet someone has spent some time figuring that out, right?
Yeah.
But I'm curious, like you said, it's just a matter of you're working the ump or you're just really that good. You're putting in that spot every time, and then the element of the catcher just moving it up and just framing the good spot.
Good
framing
catch,
is another, again, the human element of baseball. That's the beauty of it. It's sometimes you get hit with the big adversity of an ump who's just all over the place, and sometimes your catcher's saving it and he's making all the good frames, and it's just, again, you don't want to see that go away sometimes.
I have to admit, though, so on the counter argument of why you do it, I think tennis would be the best, right?
Absolutely. I've had these discussions with my friends. Yeah.
Because you still got the judge, he's still sitting there, and they're still in the chair, and they're still, but it's you got the system making the calls.
And that too is just it's so interesting how that system exists, but we're still using chains to figure out first down markers in football.
Yeah, that's part of the fun.
How is there not the famous, the index card that back, I don't know, 10 years ago, they were using index cards. Is there a little bit of space with the index card between the chains? It's not a first down or whatever. It's a human element in
because
sport.
they clearly ran in a perfectly straight line out. Right. They didn't. Exactly. And they're using an index card. It's crazy.
Yeah, that's a weird thing that I don't know if we'll see it sooner than later, but better ball spotting in the NFL, or this crazy tennis tracking system in Major League Baseball or other sports where you really got to figure out if it's on the line or not or whatnot, and it's just
You see it in soccer now too, right?
Yeah.
In terms of offsides and the ball is chipped or like all the, yeah. I don't know. It's crazy. It's
Yeah, I
crazy.
think in general, sports are just more reviewed now. Coaches are getting more challenges across all the major sports. They're getting all these opportunities to challenge plays, and it's just going to take a little bit of that stuff out. And yeah, it might be a little more accurate over time, but then
It slows things down.
oh, it does, doesn't it? Those challenges all the time, and then you get rewarded with extra challenges when you get another one if you get one right.
Right.
It's just like, oh, okay, you get another 10-minute break in the middle of the game for something that you want to challenge. And we're even seeing it, at the Division III football level. Like we had our first game of the season. Our coach threw a red flag and challenge. I was like, wait a minute, when did this become a thing? And I was like, we have replay technology now in live game. Like I never saw that before in a Division III football game. And I was like, oh, this is kind of crazy.
That is cool.
And I was like, I wasn't expecting it, but I saw it happen, and it happened a couple times in the game. And I was like, oh, and then that first half took forever.
Wow. Of course, yeah. Pretty soon, high school football.
Yeah.
Next up. Yeah.
It trickle down effect, right?
Trickle down
I
effect.
mean, it's the trickle. Like what happens at the highest levels eventually works its way down to the
for sure.
Yeah. What do you think about Tua? Do you think he's back in? It's a blind guess. No, I don't want to say blind guess, but it is a big guess. I understand. Do you think he's back 4 weeks after the whatever it was, like 2 weeks ago, right? Like, so
Yeah.
Is he back in another 2 weeks? Is he back in 6 weeks? Is he back in 8 weeks?
I have no idea.
Yeah.
I really, it wouldn't shock me if he was done for the season. It wouldn't shock me he was back in a couple weeks. Anything in between. Like I really don't know. I really don't know.
It's like, again,
What's
one of
your
those
guess?
things where like we always say we don't know what his symptoms were after this concussion. We don't know how long it was. I think I read something online that he apparently, quote unquote, feels fine, and then he met with some neurologists, and he traveled with the team last week when they went to Seattle. So he's with the team, he's involved. I mean, he already came out and said he wasn't retiring, so I think that puts a tick in. Like, I think he's coming back this year. Do I think he should? I don't think so, personally. And I also think it's just like it's tough. Where like, from him, you're a guy who has so much money in your pocket, and you're such an investment of this organization. But yet you go out and don't do the things we ask you to do and just slide, man. Just slide.
Yeah.
And like I hope to God that you don't, if you do slide, you don't get a dirty hit and still get hit in the head. Like that's just the unfortunate nature of football, though. But like if you're going to be our guy, just do what we've been training you to do and how to help. Just slide, man. Like if we don't get the first down, at least you got a break. You know, like so I think we'll see him back.
Yeah.
I think the timeline, 4 weeks. I guess I think they just doing that just to kind of. I think. Their coach at least said, the beauty of the injured reserve is that we have 4 weeks, we have no timelines. I don't have anything else, but that's our timeline. But then after that timeline, I think there's a 21-day
battle begins.
Yeah, the 21-day window of like, is he coming off the IR? Is he coming back? So that's like it gives him a cushion of 7 weeks total.
Yeah,
I think he comes back in that time frame.
If he is, again, a very, very, I think, controversial thing, but I'm just kind of curious your thoughts. If he kind of passes all of the testing, and he's at a point where, theoretically he should be cleared, is there benefit to staying out longer than that? Or like once you're there, you're there. Like it doesn't necessarily matter. And is that a question that has been answered?
No, it's not a question that's been. We really don't know how long it takes the brain to heal from one of these concussions. And the natural answer would be, well, the longer you stay out, the longer you have a chance to heal, right?
Right.
Maybe.
Yeah.
Maybe.
Yeah.
That's a very honest answer.
Yeah, maybe. I don't know. And I think that the challenge is that when he is, like, if he is cleared, the term cleared is a very paternalistic term, right? So, like, I know what's best for you, and I'm going to make that decision on your behalf, right? And where the world has gone is more, informed, it's shared decision making, informed consent, right? So here are your risks of playing. Here are the benefits of playing.
Yeah.
Your decision. My job is to make sure that I provide those lists.
As long as you understand the situation.
As long as you understand the situation.
And if you understand the inherent risk of football, like no one's making you play football, but
That's
you still
right.
want to go out there and do this and take this risk, then I guess like.
The where it falls apart a little bit, in my opinion, is that we, as the medical staff, our job is to operationalize the plan. right? So, for example, it used to be that if you had an implanted cardio defibrillator for a cardiac condition, that you were disqualified from sports. That's not the case anymore. You as a cardiologist, reading the riot act to the athlete, do you understand that you're could have an event, your defibrillator could fail, and as long as there's an AED on site, then they should be able to deliver a shock and save you if the AICD fails. Right. Well, that's all fair and good, but as a team physician, now it's my job to make sure that actually happens.
Right.
And I struggle with that because if there's ever an event on the basketball court, like the plaintiff attorney is going to be like, let's count how long it took for the AED to arrive on site. And so I think that it's really challenging in this day and age of shared decision making. Like if this were me and I've been doing this for 23 years, like I don't know what decision I would make. So how do we expect a 26-year-old without medical knowledge to make that informed decision? I don't know how we can expect that.
It makes it a lot harder.
It does.
Yeah, and then to go with that in the same example you gave as the athletic trainer, right? You're covering all these practices day in and day out, and in the perfect world, I would cover all practices and be present. Yeah. But the world isn't perfect that way, and we have multiple sports going on at once, and you operate by just
different locations,
just communication symptoms. Like most of the time, it's like a walkie-talkie's out there at practice, and we have a walkie-talkie on us. So you call us, and there's a transition time from getting to point A to point B, and different things like that. But having those discussions I've had an athlete try to get cleared who had a defibrillator implanted on his side, and I was just like, what are we going to do with this kid? If something happens and we're not there, or the coaches can't get to the AED that's in the box fast enough, or whatever, or who's to say he's doing an individual workout? Because how many times you see athletes just in the gym by themselves? And it can just happen randomly. We've even talked about sudden cardiac arrest plenty of times, and even LeBron James' son, who he also went down with a cardiac issue, and just there's no warning sign, and there's not like a big
nobody's immune when this happens to someone like that.
Yeah. There's always even when you bring in a contractor, right? It's sales versus operations, right? Well, the guy who came out and said, I could play, or the guy who comes out and says, I can redo your basement, and the basement guys get there and they're like, oh, this is gonna be a much harder job than what they told you. And it's there's always conflict between kind of the information giving people, and then how do we make that happen? How do we make sure that an AED is within 10 seconds of someone when something happens?
Right.
So it's the same thing with concussion. Like we could read the riot act, but ultimately, like the decision is going to rest with Tua, he's got to make a decision. The problem is that the people that are giving, I hope to think that the people that are giving him advice and the people that he is listening to are people who have his best interests in mind.
Yeah, right.
Not what's best for the Dolphins, not what's best for his agent, not what's best for the team physician. What's best for him is who he should listen to.
And with that, if I had to predict, I'm guessing he comes back one of the first weeks he's eligible, if not the first week. And I don't know if that's in his best interest or not. I really have no idea. But I would say that if it were my son, that I would probably say no. But at the same time, I have a feeling that's how it's going to shake out.
Yeah.
And then it's just one of those things too, just to kind of last second of like, $200 million is life-changing money, right? Like doing this generational money where like, you take those inherent risks and you can pass that on. Is it worth it? I mean, that's, again, it's just one of those crazy things where the situation just has so many external factors of like what's going to happen. And all it takes is football plays, 6 seconds? And things can change. We've seen it. Like with the Tua issues, with the DeMar Hamlin situation, with all these different injuries that we've talked about. It's just instantaneous. It happens. It could happen.
How many weeks it transpired, and I don't want to, we're winding down, but how many weeks it transpired 2 years ago between the first concussion and the second concussion? Like how quickly?
For Tua, you mean?
Yeah.
So the first one was September 25th.
He was back the next week, wasn't he?
The next week he was back 4 days later.
4 days later.
The 29th. And then after that he was out for 4 weeks, and then he came back and finished that season.
Yeah.
Then he went 2023. scratch-free,
Yeah,
luckily,
yeah.
and I think
As far
he
as
was
we know, yeah.
sliding really good, and then
It's unfortunate.
he got. And you know what's the craziest part too is like if he just slid, he would have had the first down anyway.
I know.
You know,
Yeah.
like he was at least 3 yards ahead of
Yeah.
the line, like just sliding.
Yeah.
But these are really tough situations, right?
Oh, yeah.
Like, you know, these are really tough. Like we if he had not suffered a concussion, right, the whole world would have been applauding.
What a
yeah.
play.
Right,
What a play, what
a
effort.
gamer,
Uh-huh.
what an
Yeah.
effort, what, you know, and so like it's hard to turn that
Yeah,
off.
right,
It's
right.
really hard to turn that off.
And he's in his position because he is a competitor, right?
Right.
Like we've said that before.
Yeah.
He's
why
not
he's
a
here.
starting quarterback in the NFL because he doesn't like competition.
Yeah,
Right.
right.
All right.
Well, Dr. Harwood, thanks for coming out. This was
Yeah,
really
man.
fun.
My pleasure.
Welcome to the virtual team.
Yeah, welcome
Thank
to the
you.
team and welcome to the show and
Yeah.
welcome to come back whenever you want.
Speaking of virtual,
Yeah, absolutely. Before we close out our tab, we're going to give a quick shout out to some of our sponsors here, Virtual Orthopedics and Spine. They have you covered from runner's knee and dog walker's hip. They have a doc for that. Yardware back and laptop rift. They also have a doc for that. Virtual Orthopedics and Spine has over 120 providers, over 20 PT and rehab facilities, and more than 25 surgical centers all across South Jersey. So find the right specialist for you at virtua.org/ortho. Also giving a shout out to Neck of the Woods Brewing Company, a serving of the best beer in South Jersey, and Timber Rip Productions and our guy Kyle over there to help us get all this media together to get it out to all our supporters and fans. So thank you, everybody. Have a great time, and we'll see you next time.